Ladies and gentlemen, especially our respected seniors, I want to speak to you today with sincerity, clarity, and deep concern. Too many older adults place unquestioned trust in every pill that promises relief, energy, strength, or youthfulness. But sometimes the very thing that claims to help you can quietly strain the organ that keeps you alive, your heart. Many pills marketed to seniors can silently strain the heart and increase cardiovascular risk because they often promise quick relief from pain, energy loss, insomnia, memory problems, or weakness without clearly revealing the stress they place on the cardiovascular system. As the body ages, the heart and blood vessels naturally become more sensitive, less elastic, and sometimes weaker. So when a pill triggers rapid heart rate, raises blood pressure, retains fluid, or interferes with circulation, the impact is more intense than it might be in a younger person. Many medications and supplements work by stimulating the nervous system, tightening blood vessels, or altering fluid balance, and while these effects may temporarily reduce symptoms, they also force the heart to pump harder and faster, adding unnecessary strain. Some pills also contain hidden stimulants or high doses of ingredients that may not be obvious from the label, especially when they are marketed as energy boosters, fat burners, or herbal remedies that appear harmless because they are labeled natural. Yet the heart does not differentiate between synthetic chemicals and strong natural compounds. It simply reacts to the pressure placed upon it. When seniors take these pills regularly or combine them with other medications for blood pressure, diabetes, cholesterol, or arthritis, dangerous interactions may occur without immediate warning, slowly damaging the heart, affecting rhythm, tightening arteries, or increasing the risk of complications like arrhythmias, heart attacks, or worsening heart failure. What makes this issue even more serious is that many seniors believe availability equals safety and assume that if a pill is sold in stores, marketed online, or recommended casually by someone they know, it must be harmless. But hearts weakened by age or previous conditions cannot tolerate unnecessary stress. Another silent danger is that side effects often do not appear dramatically at first. They may begin as mild fatigue, slightly faster heartbeat, occasional dizziness, swelling of the ankles, subtle shortness of breath, or chest pressure that is brushed aside as aging or tiredness, while in reality the heart is being pushed beyond healthy limits. This problem grows when seniors self-medicate without guidance, taking pills for quick relief instead of medical supervision, sometimes doubling doses, switching brands frequently, or trusting advertisements more than professional advice, unaware that the cumulative effect can burden the heart day after day. Even over-the-counter medications like certain pain relievers and cold medicines can increase blood pressure or fluid retention, making it harder for the heart to function comfortably, yet many people take them casually without realizing the risk. Supplements can also be misleading because some contain strong compounds that thin the blood, speed up the heartbeat, or affect circulation, particularly when combined with prescribed heart medications, and this invisible strain builds quietly. The truth is that the aging heart requires gentler support, careful monitoring, and medically guided treatment, not pills that shock, force, or overstimulate it. Because every heartbeat matters and every extra load placed on it can create harm rather than healing. Seniors deserve awareness, careful choices, honest information, and responsible medication use so their hearts are protected rather than unknowingly pushed toward danger. Over-the-counter or natural does not automatically mean safe, especially for aging hearts, because these terms often create a false sense of security that leads many seniors to underestimate potential risks. Medications and supplements available without prescription are frequently marketed as convenient, gentle, and harmless, yet many of them still have powerful effects on the body, including the cardiovascular system. Aging changes how the body processes substances, metabolism slows, kidneys and liver may work less efficiently, and the heart becomes more sensitive to changes in blood pressure, heart rate, and fluid balance. A pill that might seem mild for a younger adult can have a much stronger impact on an older person, and when taken repeatedly or combined with other medications, it can stress the heart in ways that are neither obvious nor immediate. Natural products often sound safer simply because they come from plants or herbal sources, but natural does not equal harmless. Many plant-derived compounds can raise heart rate, constrict blood vessels, thin the blood too much, or cause dangerous rhythm disturbances, particularly when mixed with prescribed heart or blood pressure medications. Some herbal supplements contain stimulant-like ingredients that increase cardiovascular workload, while others interfere with medications meant to stabilize heart function, making treatment less effective. Over-the-counter pain relievers, decongestants, sleep aids, or diet pills can also raise blood pressure, cause fluid retention, or affect circulation, placing silent strain on the heart even when they are taken exactly as the label recommends. The challenge is that labels often highlight benefits while side effects are printed in small text or explained in complex medical terms that many seniors may not fully understand. Another concern is that seniors often take multiple medications at the same time for conditions like diabetes, hypertension, cholesterol issues, arthritis, or anxiety, and when an additional over-the-counter product or supplement is added. The combination can create interactions that doctors never planned for. Many people assume that if something is sold widely, advertised publicly, or recommended by friends, it must be safe, but regulatory standards can vary, especially for supplements, and some products may not even contain exactly what the label claims. There are also cases where dosages are stronger than expected, ingredients are mixed in risky ways, or unknown substances are added to enhance effects, which can further endanger heart health without the user realizing it. Seniors may also keep taking these products for long periods, thinking they are harmless, allowing subtle damage to build up quietly while symptoms are mistaken for normal aging. Shortness of breath, swelling in the legs, fatigue, palpitations, dizziness, or chest pressure may be overlooked even though they can indicate that the heart is under stress from something being taken regularly. Trusting the words natural or over-the-counter makes many people skip professional advice, but guidance is essential because only a qualified health professional can check interactions, evaluate heart risk, and determine whether something is safe for an aging body. Awareness is vital, because the label's friendliness, the product's popularity, or the word natural does not protect the heart. Informed caution, medical consultation, and careful choices do. Self-medication and mixing pills without guidance can dangerously raise heart rate, blood pressure, or cause rhythm problems because when people try to manage their own health without professional advice, they often underestimate how powerful medications and supplements really are, especially for seniors whose bodies are more fragile and whose hearts are more sensitive to chemical changes. Many older adults deal with multiple health conditions at the same time and already take prescribed medications for blood pressure, diabetes, cholesterol, arthritis, anxiety, or heart disease, and when they add extra over-the-counter drugs, herbal supplements, painkillers, energy boosters, or sleep aids without medical supervision, the combination can create reactions inside the body that stress the cardiovascular system in unpredictable ways. Some pills increase heart rate by stimulating the nervous system, others narrow blood vessels and raise blood pressure, while certain substances cause the body to retain fluid, making the heart work harder to pump blood effectively. Without guidance, seniors may unknowingly take two products that contain similar active ingredients, unintentionally doubling the dose and pushing the heart beyond safe limits. In other cases, they may mix natural supplements with prescription heart medications, believing herbs are harmless, while some herbal compounds actually interfere with heart rhythm, blood thinning, or blood pressure control, turning the heart's normally steady beat into something irregular and risky. Self-medication often happens because people want fast relief, they trust advertisements, or they rely on suggestions from friends instead of medical evaluations. Yet what feels like harmless independence can quietly become a dangerous gamble when the heart is involved. Another problem is that seniors sometimes adjust their own dosages, increasing pills when they don't feel enough benefit or continuing products for longer than recommended, not realizing that prolonged exposure can intensify cardiovascular strain. Warning signs like rapid heartbeat, shortness of breath, swollen ankles, Dizziness, chest tightness, or unusual fatigue may be ignored or blamed on aging, while the real cause is the hidden conflict between different pills working inside the body. Even common medications like decongestants for colds, certain pain relievers, weight loss pills, and energy enhancers can quietly raise blood pressure or trigger abnormal rhythms, especially when combined with heart or blood pressure medicine already prescribed by a doctor. Seniors who do not regularly review their medications with a professional may not realize that their health has changed over time and that something safe years ago may now be risky because the heart is older, the arteries are stiffer, and overall tolerance is lower. Without medical guidance, no one is monitoring how these combinations affect circulation, oxygen demand, heart workload, or blood pressure stability, and small mistakes can accumulate into serious cardiac stress. Sometimes family members unknowingly contribute by suggesting pills they use themselves, forgetting that every body is different and that what works for a younger adult can overwhelm an aging heart. Pharmacies, advertisements, and online promotions can make self-treatment seem simple, but the heart does not respond to popularity or convenience, only to the biological pressure placed on it. When pills are mixed without professional oversight, the risk of silent damage and sudden cardiac complications becomes significantly higher, especially for seniors who already live with reduced cardiovascular reserve and need careful, medically guided choices rather than risky combinations taken independently. Seniors must consult qualified health professionals before taking any new medication or supplement because as the body ages, it becomes more sensitive to chemical changes, and only a trained expert can evaluate how a new pill will interact with existing health conditions, ongoing treatments, and the natural limitations of the aging heart and circulatory system. Many older adults already live with conditions such as high blood pressure, diabetes, kidney problems, heart disease, or circulation issues, and they often take multiple prescribed medications daily to control these problems. So adding anything new without professional advice can create dangerous interactions that are not obvious on a label or in an advertisement. A doctor or pharmacist understands how certain substances can raise blood pressure, speed up the heart, cause fluid retention, disturb heart rhythm, or reduce the effectiveness of important medications needed to stabilize health. So consulting them provides protection that guesswork cannot. Health professionals also consider factors like age, weight, kidney function, liver health, current diagnoses, and previous medical history before allowing any additional product, which is something most seniors cannot accurately judge alone. Many supplements and over-the-counter pills look harmless because they are easy to buy, heavily promoted, or labeled as natural. But professionals know that natural does not automatically mean safe, and that even plant-based compounds can strain the cardiovascular system or interfere with prescriptions. Doctors can review every pill a senior is taking, check for duplications, unsafe combinations, or unnecessary products, and help decide what is truly beneficial and what may quietly threaten heart health. Professional guidance also prevents common problems like taking higher doses than needed, staying on a product longer than safe, or using multiple pills that do the same job but intensify side effects together. A consultation provides the opportunity to discuss symptoms honestly, such as dizziness, swelling, breathlessness, chest pressure, palpitations, or unusual fatigue, which may be signals that the heart cannot handle current medications. And a professional can recognize whether these signs are related to aging, illness, or something being taken. Without expert advice, seniors may rely on advertisements, online claims, or suggestions from friends who do not understand their specific medical situation, and this can lead to decisions that put unnecessary pressure on the heart. Health professionals also help seniors understand that what worked years ago might no longer be safe now because the body has changed and may no longer tolerate certain ingredients the same way. Consulting a doctor encourages regular medication review, helps remove unsafe or outdated pills, and ensures that every substance entering the body serves a real medical purpose instead of risking silent harm. Professional guidance offers reassurance, safety, and informed decision-making, replacing uncertainty with knowledge and replacing risk with medically guided care so the heart and overall health are supported with responsibility rather than guesswork. Early awareness, regular medication review, and attention to warning symptoms can prevent serious heart complications because when seniors stay informed and proactive about what they take and how their bodies respond, problems can be identified before they become life-threatening. Awareness begins with understanding that every pill, whether prescribed, over-the-counter, or natural, has effects that reach the heart and circulatory system, especially in older bodies where blood vessels are stiffer, heart tissue may be weaker, and overall tolerance to stress is lower. When seniors recognize this reality, they are less likely to ignore warning labels, skip instructions, or assume everything is safe simply because it is widely available. Awareness also means knowing what to watch for. Symptoms like unusual fatigue, rapid heartbeat, swelling in the legs or feet, shortness of breath, dizziness, chest tightness, or sudden weakness are not just normal aging. They can be signs that the heart is under unnecessary strain caused by medications or supplements, and early recognition gives time to seek help before damage progresses. Regular medication review is another powerful layer of protection because over time, prescriptions change, health conditions evolve, and what was once suitable may become risky. Doctors and pharmacists can evaluate whether certain pills are still needed, whether doses are appropriate, and whether any combination of medications or supplements is creating silent stress on the heart. Seniors who review their medications routinely are far less likely to experience dangerous interactions because professionals can remove unnecessary products, replace safer alternatives, or adjust treatments to better support heart function. This becomes especially important when seniors see multiple doctors because without proper review, different prescriptions can overlap or conflict without anyone noticing until symptoms appear. Medication review also helps ensure that instructions are being followed correctly, since misunderstandings, accidental double dosing, or forgotten guidance can lead to harmful cardiovascular strain. Paying attention to warning symptoms is equally essential, as the heart often gives early signals before a serious event occurs. Instead of dismissing discomfort as tiredness or age, seniors who listen to their bodies seek help sooner, allowing doctors to detect problems like rising blood pressure, irregular rhythms, fluid buildup, or medication side effects while they are still manageable. Awareness encourages seniors to ask questions, read labels carefully, avoid unnecessary supplements, and rely on professional advice instead of advertising claims or casual recommendations. Families also play a role by staying engaged, asking what their loved ones are taking, noticing unusual tiredness or breathing difficulty, and encouraging timely checkups, because sometimes seniors minimize symptoms out of fear, stubbornness, or habit. When early awareness, medication review, and symptom vigilance come together, the heart receives protection instead of surprise pressure, and seniors gain control over their health rather than leaving it to chance. This proactive approach reduces hospitalizations, prevents sudden complications, and supports longer, healthier living by respecting the delicate condition of the aging heart and ensuring every pill taken is truly necessary, carefully monitored, and safe for the stage of life a senior is currently in.